Hello and welcome to our first instructional PowerPoint. During this presentation, we will focus on building an overall understanding of the various types of literacy assessments. So what is literacy assessment? In essence, it's a measurement of student learning and progress. It's how we define student achievement, how we quantify student progress, and determine student skill mastery. Assessment can help us determine the best instructional approach. Some tests help us discern the optimal instruction or skill to target. The timing of an assessment provides different information and serves different purposes. Testing prior to instruction can pre-assess what students already know and help us plan to meet their needs. Assessment during instruction allows us to tweak instruction to better meet a student's need in the moment. I think educators tend to prefer that one. And assessment after instruction allows us to determine if a student learned what we intended or mastered a skill. Some assessments carry a lot of weight when it comes to decision making about allocation of funds for a district or the efficacy of a program. It's helpful to keep in mind that assessments often come with consequences, and it's up to us to make sure we are using them appropriately. The more we understand about assessment, the less likely we are to use them incorrectly and dislike them. Assessment is part of a process, so it's always good to step back for a moment and think about where it fits. Assessment and instruction cycle together. In the problem-solving process displayed in this graphic, you can see that assessment falls in the blue evaluative step of a cyclical process. Note the emphasis here on using triangulation of data as part of this process. When you use multiple points of assessment data, you're more likely to understand the strengths and needs of a student, as opposed to using a single test score. When you continually return to reassess student learning, you will further fine-tune the instruction to meet student need. As we'll discuss, it's important that there is construct validity, meaning there's a match between the assessment and the target skill. In other words, that the assessment actually tests what we want it to test, or what we think or are told it tests. All of the different assessment types work together to provide a more complete picture of a student's abilities. There are 6 types of assessment in this graphic, each with their own symbol, and that helps us understand its purpose. So the magnifying glass is representative of diagnostic assessments. These tests assess a student's specific area of instructional need. They help us look more closely into what students know and what they still need to learn. Examples of some diagnostic tests include the Fontes and Pinnell benchmark assessment system, the Words Their Way spelling inventories, the DRA developmental reading inventory, the QRI qualitative reading inventory, and I guess pretty much anything with the word inventory in it. Formative assessments are displayed as a piece of the pie. These assessments are done throughout the learning process and assess a student's performance during instruction. Exit slips and running records are great examples of this, as are your classroom everyday observations. The trophy given at the end of a race is the graphic for summative assessments. These measure a student's performance at the end of instruction. Norm-referenced assessments, illustrated by the seesaw, compare a student's performance against a national or other normed group. The ACT is a great example of this because students are each compared against a national average, kind of like a bell curve. Students' progress is being weighed against the progress of a group of students used in the norm study. It's important when using a norm reference test to look at the size and demographics of the norm group. The larger it was, the more likely it is generalizable results. By knowing the demographic, you can determine if the norm group are comparable to your actual students. Criterion-referenced assessments, illustrated by a segment marked on a ruler, measure a student's performance against a goal or an objective or a standard. The access test for English learners is an example of this because students are compared to criteria to determine if they can pass a level and move on. They're not compared to each other. Last, interim or benchmark assessments the growth chart represents that, evaluate a student's performance at periodic intervals. These occur typically at the end of a grading period and are used to indicate growth and can actually be used to predict student performance on future assessments by analyzing trends. So let's take a deeper look at diagnostic assessments. Their purpose is to measure a student's current knowledge and skills, and this is done in order to identify the next steps needed for learning. These assessments should be given prior to instruction and only to some students who might be at risk or for whom we need to go deeper. Diagnostic assessments are not given universally. The results of these assessments are used to inform educational decisions about what to teach or which intervention strategy or program might be needed. We'll look at several diagnostic assessments within this course and go in depth with one, the qualitative reading inventory. We'll also look at several phonemic inventories. You'll find many of these within your RTI textbook, along with recommended instructional steps to follow. Next, everyone's favorite, formative assessments. They tell us how students are responding to our instruction. They're administered during instruction and can be formal or informal. An example of formal might be a quiz or a checklist of skills that the teacher uses to monitor student progress throughout a day or a week. An example of informal might be a quick exit slip, listening while two students talk to each other. Formative assessments are typically administered to all students during benchmarking time, which may also be at the end of a unit or grading cycle. You may also administer additional formative assessments to some students of more concern for progress monitoring. Formative assessments are useful in making educational decisions. They can help us identify students who are not responding to our instruction or making adequate progress with an intervention. We use data from formative assessments to determine which curriculum to use and which skills to teach. They help us evaluate programs to see if they're effective with our students, and on a larger scale, they can inform resource allocation and comparisons of instruction and intervention. Summative assessments tell us what students learned over a period of time and are administered after our instruction. They're administered to all students. These assessments are noted for being used to make educational decisions around accountability, skill mastery, and resource allocation. Grade-level common assessments can be used to reflect on common teaching practices and instructional techniques within your PLCs. Other examples are end-of-year curriculum tests and district-wide annual assessments. Your final MAP or STAR test of the year could be considered summative since it summarizes the student's growth throughout the school year. So let's quick review these three to lock them in. Diagnostic assessments given before instruction help identify a student's skill strengths and weaknesses. Formative assessments given during instruction help us adjust and guide students and instruction as necessary. And summative assessments are a final snapshot of what students learned as a result of our instruction. Now, these two are difficult, norm versus criterion referenced. I still tend to confuse these, so let's talk a bit about them. They tell us very different information, and they're often misinterpreted. As a literacy teacher or a specialist, it's important that you can accurately explain to parents and other staff what these assessment scores do and don't tell us. Norm-referenced tests rank test takers on a bell curve. They're designed strategically so that only a small percentage of students will perform well. Most will perform average, and a small percentage will perform poorly. This is accomplished by designing test questions that will accentuate different performance among test takers. They're designed so not all students perform equally. They do not determine if students have achieved a specific standard or content or skills or knowledge. This is a common misinterpretation. Some examples of norm-referenced assessments are the ACT, the Scholastic Reading Inventory, and the MAP when it ranks students by percentile. Criterion scores, however, do measure performance against a fixed set of standards or criteria. Scores on these tests are assigned performance levels like emerging or high average. Examples of criterion scores are the Access for English Learners and PALS. The MAP and STAR tests are complicated because they include both norm-referenced and criterion-referenced scores depending on how they present the information. They might rank students against each other for a percentile, or they might rank them against standards by saying average or above average. So comparing these two types of tests, on a norm-referenced exam, the score would reflect how many more or fewer correct answers a student gave in comparison to other students, whereas criterion-referenced tests results are often based on the number of correct answers and a score is expressed as percentage of total possible correct answers, like 80% correct. We should also talk about CBM, which might be something you've heard of or are familiar with. In education today, we're working to monitor student growth in response to intervention, RTI. In the business world, change is monitored at regular intervals by GOMS, or general outcome measures. Like in medicine, we take your blood pressure to see if your blood is flowing at an appropriate rate. McDonald's might tally how many hamburgers it sells to measure how business is going. These measures all assess general outcomes and are data-based and timely. However, they do not measure all aspects. They are used simply because they are easy, accurate, and inexpensive. They're collected on an ongoing basis over time, and they shape a variety of important decisions. In literacy education, we have our own GOMS called CBMs, Curriculum-Based Measurement. These allow us to make important statements about our students' reading, spelling, and written expression. A common RCBM, or reading curriculum-based measure, used is timing a student for 1 minute as they read a grade-level passage. Typically, this is done 3 times, and you determine the average or the mean or the median score, which becomes a fluency score expressed as words per minute. You'll find these in Ames-Webb, Dibbles, RCBM, other assessments. If a student scores significantly below a determined norm score, we know we need to look deeper and figure out what they need. There are several limitations to this kind of assessing, though. For example, 1 minute is a very short sample of time, and a student's familiarity with the vocabulary or the passage content may affect their performance, and we make them read at grade level even if they're not able to read at grade level, and so on. A CBM gives us valuable information, but it only measures individual, discrete skills and doesn't paint a whole picture of student performance. But one benefit is that the assessment is very sensitive to change, so it can be given weekly and even bi-weekly, and we can see noticeable changes over time. So some things to remember when considering CBMs. They're designed to serve as indicators of general reading achievement and do not measure everything. They are standardized tests and need to be interpreted in a standard way. They're sensitive to improvement in brief intervals of time, which is why we like them, and they are designed to be as short as possible to ensure doability. We've reviewed several major types of assessment and looked at their function and what they tell us. With each of these assessments, we need to consider a few key factors, though. Is the test, whatever kind it is, fair? Is it reliable? Or said another way, is there stability in the test scores? Meaning, was the score a one-off, or can it be easily replicated in a predictable way? And is there construct validity? Meaning, does it actually measure what it says or what you intended it to measure? And finally, are we going to use these results to make decisions that are logical and justifiable? Additionally, specific factors about the test can make a difference. For example, the types of questions on a test make a difference for individuals taking the test and overall in what they're measuring. Multiple choice questions require different knowledge and skill than constructed response, where the test taker needs to remember all of the details and connect their thinking through writing. A performance task, which typically integrates several steps, requires even different knowledge and skill. Different still are teachers' informal observations of a student actually using that skill. Next, the test-taking method matters, whether the test is given orally, with pencil paper, or clicking on a computer. Each of these requires different skills to produce the results. Today, there are more tests that are computer adaptive, such as the MAP, the SRI, and STAR. These assessments adjust the difficulty of each test item based on how the student is performing to zero in on their just right level of accuracy. And how tests are scored also factors into the equation. Are the tests scored by one person, a group of people, because then we're talking about calibration, or by a computer program? Each of these may produce different results. So back to where we started, assessment is key to the problem-solving instructional process. You can't have instruction without assessment and vice versa. Different assessments have different purposes and tell us different things. It's important to pay attention to the details of an assessment or you may draw the wrong conclusions. We will attempt to apply our knowledge of these assessments that we have learned about here to better understand the assessments we actually use in our own districts. Most educators remark that there's simply too many assessments and it's overwhelming to look at the list. However, once we categorize each one and see how they provide a different piece to a bigger puzzle, it suddenly makes sense why we need such a variety of assessments available to us.